This is part 3 of our Breaking Into MedTech series. In part 1, we covered why so many qualified candidates get shut out of this industry. In part 2, we talked about finding your therapy area and why that's the foundation everything else sits on. Today, we go one level deeper. We've included a link to the full series in the description. Most candidates who want to break into MedTech have already decided what they want to do. Before they really understand what that means, they want to be in sales, or they want to do R&D or product development. And they pursue that with complete conviction, without ever stopping to ask whether that conviction is based on reality or assumption. What nobody tells you is that the gap between what a role looks like from the outside and what it actually feels like from the inside can be enormous. And in a journey career like MedTech, stepping blindly into the wrong functional role doesn't just cost you time. It costs you momentum and credibility that takes years to rebuild. Today, we're going to give you a clear picture of the two worlds that make up the functional landscape of MedTech: the field-facing world and the internal world. We're not going to give you a blueprint because the honest truth is there isn't one. Every company, every division, every therapy area is different. What we're going to give you is enough context to ask the right questions and point you toward the one tool that will tell you more about your specific path than anything else we could say in this video. Let's start with the field-facing world, because that's where most candidates point themselves when they think about MedTech. The field-facing world has two sides. On one side, you have field-based clinical and technical support. These are the people in the room during procedures. They know the technology inside out. They support clinical teams in real time. They build deep relationships with surgeons, physicians, and clinical staff over months and years. In many therapy areas, they are the backbone of what makes a commercial team function, and they are the people that sales teams lean on most heavily when the clinical complexity is high. On the other side, you have sales, territory management, account ownership, revenue targets, building and owning a book of business in a defined geography, high performance, high accountability, and in most cases, highly rewarding for the people who earn their way there. The reason we describe it as earn their way there is important. You cannot sell what you don't know. In a field where your credibility in front of a surgeon or a physician depends entirely on your ability to speak their language, understand the clinical environment, and back up every conversation with genuine product knowledge. That knowledge has to come from somewhere. And for most people without prior MedTech experience, it comes from time in a field-based clinical and technical support role. How long that takes varies enormously. It depends on the company, the division, the complexity of the technology, and how quickly you learn, build relationships, and establish yourself as someone worth betting on. In some of the most technically complex therapy areas, orthopedics, neurology, structural heart, cardiac rhythm management, electrophysiology, the learning curve is steep and the timeline is long. In other divisions, the pathway into a sales associate role or eventually a direct sales role can move more quickly. But in every case, the journey starts with knowing the product and the clinical environment better than anyone else in the room. The one thing we will say clearly, there is no universal algorithm for this. Anyone who tells you there is has either never hired in this industry or is oversimplifying it to the point of doing you a disservice. The pathway in your specific therapy area and division is unique, and the only way to truly understand it is to go and talk to someone who has already walked it. Now, let's talk about the internal world, because it is a completely legitimate and often overlooked part of the MedTech landscape. R&D, product development, quality assurance, human factors engineering, technical services, regulatory affairs. These are the roles that build the technology, validate it, improve it, and bring it to market. They are largely desk-based. They are deeply technical. And for candidates coming out of engineering programs or scientific backgrounds, they can be an incredibly compelling entry point into the industry. What we see fairly regularly is engineers who graduate thinking they want to be in R&D or product development. And they are right to pursue it if that's where their interest genuinely lives. But we also see engineers who spend a year or 2 or 3 in those roles and then get exposure to what the field does. And something shifts. They realize they are fundamentally field people, that they want to be in the room, that they want the pace and the relationships and the clinical environment that a desk-based role can't give them. The reverse happens too. Field-based people who discover a genuine interest in the engineering and development side of the business and want to move internally, assuming they have the qualifications to do so. Both transitions are real, and both happen more than most people think. The point is that neither world looks exactly the way you imagine it from the outside, and the only way to find out whether it actually fits you is to talk to someone who is already doing it. Which brings us to the most important thing we're going to say in this video, and it is something that almost nobody tells candidates. Before you commit to a functional role, go and talk to people who are actually living it, not recruiters, not hiring managers, not job descriptions on LinkedIn, real people currently doing the job you think you want. Ask them what a Tuesday looks like. Ask them what surprised them most when they started. Ask them what the hardest part of the job is that nobody warns you about. Ask them whether they would make the same choice again. That conversation is what we call an informational interview, and it is the single most valuable and most underused tool available to anyone trying to break into this industry. The reason it is so powerful is simple. You don't know what you don't know. No job description, no YouTube video, no career fair conversation will give you the felt reality of what it is actually like to be a field-based clinical specialist scrubbing into your third case of the morning at 6:30. Or to be a product development engineer 18 months into a role realizing that the desk and the data are not where your energy lives. Or to be a sales associate 3 months in with a quota and a territory and a technology you are still trying to master. Those insights only come from people who have been there. And the good news is that MedTech is full of generous people who are willing to share their experience with someone who comes to them with genuine curiosity and a thoughtful question. Finding those people, reaching out to them without it feeling awkward or transactional, and knowing exactly what to ask when you get in the room. That is the entire focus of Part 4. We are going to walk through the informational interview process step by step. That one drops next. Make sure you are there for it. So let's land this. There are two worlds in MedTech: the field-facing world, clinical and technical support, sales, commercial roles, and the internal world, R&D, product development, quality, human factors, technical services. Both are legitimate. Both have value. Both feel completely different from the inside than they look from the outside. If you are drawn to the field, understand that knowing the technology and the clinical environment is the foundation everything else is built on. Most people earn their way into commercial roles through time, in field-based clinical and technical support. How long that takes and what that pathway looks like in your specific therapy area and division is something no video can tell you, but the right conversation with the right person can. If you are drawn to the internal world, go and find someone doing the role you think you want and ask them what it actually feels like from the inside before you commit to pursuing it. You might find it confirms everything you hoped, or you might find out something that changes the direction entirely. Either way, you will be better positioned for knowing. MedTech is a journey career. The candidates who build the most meaningful careers in this industry are not the ones who stepped blindly into the first role that sounded right. They are the ones who took the time to understand the landscape, asked the right questions, and made deliberate, informed decisions about where to start. Drop a comment below and tell us which functional world you're drawn to and what's driving that. I read every single one, and it shapes what we cover next. This is Part 3 of the Breaking Into MedTech series. Part 1 and Part 2 are linked in the description. Part 4 is coming next, and it is entirely focused on the informational interview, how to find the right people, how to reach out, and what to ask when you get in the room. The full series playlist is on the channel and in the description below.